Welcome to Brainstorms, Functional Neuro Rehab for SLPs, presented by SpeechTherapyPD.com. This podcast is designed for the adult medical speech-language pathologist. Most of our audience members work in settings such as acute care hospitals, private practice, outpatient hospital clinics, and inpatient rehabilitation hospitals. Each episode has an accompanying course on SpeechTherapyPD.com and is available for 0.1 ASHA CEUs. The content of this course is based on the research and experience of the presenters. The listener is responsible for researching to determine if the information and skills taught are appropriate for their clients, students, or patients. SpeechTherapyPD.com does not necessarily endorse, recommend, or favor the information shared, nor any of the claims, opinions, statements, offers, or services made by the presenter.
Hello and welcome everyone. My name is Renee Garrett and I'm your Speech Therapy PD podcast host for Brainstorms, Functional Neuro Rehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for 0.1 ASHA CEU. Here are the financial and non-financial disclosures. The financial disclosure for Ruchi Kapila is that they is a transgender, non-binary, neurodivergent speech-language pathologist. They are CEO of Kapila Voice and Speech Services, a professional corporation in Hayward, California, and is a paid content contributor for Credit Institute. They serve as a lecturer at California State University, East Bay in Hayward, California, and they receive an honorarium from Speech Therapy PD for the guest appearance on this podcast. The non-financial disclosure is they are a founding member and organizer of the Trans Voice Initiative, parliamentarians of the LGBTQ+ caucus of ASHA or LGAS, and a member who serves in a research role in the multicultural constituency group, the Disability Caucus. My financial disclosures are that I'm a paid employee of a private consulting firm in the Commonwealth of Virginia, and as the host of Brainstorms, Functional Neuro Rehab for SLPs, and other webinars on Speech Therapy PD, I do receive financial reimbursement. I am also an adjunct faculty for both James Madison University and Old Dominion University. My non-financial disclosure is that I'm the secretary for the Communication Disorders Foundation of Virginia. Now, without further ado, we welcome our guest, Ruchi Kapila, MS, CCC, SLP, NCVS, trained vocalist. She, who is the owner of Kapila Voice and Speech Services, a professional corporation in Hayward, California, which provides voice and communication services with a gender-inclusive lens as a speech-language pathologist and singing voice specialist. Ruchi also teaches singing voice in their private studio. They frequently publish, present, and educate nationally on gender-affirming voice care and intersectional cultural responsiveness within the SLP field. She is also a founding member of the Trans Voice Initiative, a board member of the newly formed Disability Caucus, and an officer and parliamentarian for LGAS, the LGBTQ+ caucus of ASHA. In addition, they serve as a lecturer at Cal State University East Bay, Speech, Language, and Hearing Science Department, and work in home health settings with adults. Welcome, Ruchi. Thank you so much for being here.
Hi, thank you so much for having me.
Of course. I have a funny, it's not a funny haha story, but it's a funny full circle moment about LGAS because way back when I was a student at my first ASHA conference, I got the great pleasure of meeting someone at the booth in the exhibit hall, which if you all have been to ASHA, can be a very overwhelming experience because it's full of lights and sounds and things and stuff. And
Sure.
it's hard to navigate. But the really cool thing was that the gentleman that was at the booth had an extra ticket to the closing ceremonies, which was just which happened to be in New Orleans that year. And I got to go on a tour of behind the scenes where they keep all of the Mardi Gras floats.
Mhm.
So it's such a cool and really pleasant connection and experience that I had. So I just wanted to kind of ice break with that because it was just, yeah, very unexpected, but also very, really cool. So, and that's been 200 years ago.
Yeah, I think a lot of us pride ourselves on spontaneity, so I appreciate that.
Yeah, for sure. So, how are you?
I'm doing as well as can manage. I think things have been incredibly busy. Just, I when we first connected, I was teaching phonetics for as a lecturer at Cal State East Bay, and then I'm teaching phonetics virtually at Minnesota State Mankato now.
Okay.
I guess I'm getting feedback that people can't hear me well.
Yes. Saw that.
Okay. So is that any better?
That is much better for me. I don't know about others. Can someone chime in and just say yes? Can you all hear better?
Okay, great.
Cool.
So
Thank you.
basically, yeah, I started teaching phonetics for Minnesota State Mankato, and then I also started covering the voice and resonance class because Dr. Anusha Sundarajan went on leave. And so basically, yeah, I've been lecturing at a couple of places. The practice has picked up quite a bit, and I do a lot of mentorship in various roles, and it's been involved. Had an article that came out for Sig 3 Perspectives pretty recently on neuroaffirming practices and voice care. And so, yeah, I've been blessed, but we're gearing up for ASHA. Just got back from Fall Voice. Things are, everything keeps moving. So, yeah, thanks for asking. How about you?
Oh gosh. Yeah. Now same. I taught a 7-week fast course on TBI. And then I'm still teaching technical rating for undergraduates right now. So we're about to wrap that up and I'm the same. I finally had a whole like hour and a half, 2 hours to look at my ASHA presentation that I started months ago and sort
Yeah,
of make sure that it's refined, but also included new things that have kind of come out research wise since I started it. So, but yeah, I'm with you, juggling 400 million things all the time.
absolutely.
Yeah.
I totally
Yeah.
understand.
So, this is to me, such a unique niche type of field for SLPs. And maybe that's just because it's not something that I do, but it's also something that whenever I would get a referral, particularly when I worked in outpatient, I would go, oh no, this isn't for me. Like I need to find a person, right? Because it is very different than what we see every day if we haven't specialized in voice and that whole, especially voice as a singing component. Because most of the time when I got a voice referral, it was someone who was having a swallowing issue that was related to their reflux disease that was impacting their vocal quality, which is markedly different and a little bit, I don't want to say less skilled because that's not true. Dysphagia is a whole thing in and of itself, but it's different from what you do.
Sure. I
And
mean,
so,
yeah. I feel like the priorities in a case like that when you're trying to navigate dysphagia versus the voice use and especially if you're talking about somebody experiencing GERD or LPR or reflux as somebody who's not like a professional voice user, there's definitely needs, but then it may not be the same as when you're working with somebody who has a performance voice background. So I totally get what you're trying to say in terms of navigating what's the priority for the patient or client. Like, is it really related to, swallowing, feeding versus voice care? And then if you're working with a performance voice client or patient, then the focus really is on the performing voice and may not have anything to do with dysphagia, even though we're dealing with a lot of the same, let's say, hardware.
yeah, yeah, that's a good way to put it. So, how did you discover that this was something you wanted to work with? So, the singing voice, and I guess maybe the better thing to kind of define first is singing voice habilitation and rehabilitation first,
Mhm.
and then maybe talk about how you discovered this was something you really wanted to do.
I knew what singing voice was when I started. I didn't know what singing voice habilitation was. And so habilitation is usually around optimizing or supporting the efficiency or longevity of one's instrument in terms of laryngeal function in terms of resonance configuration, in terms of respiratory support, and making sure that all of these respiratory, phonatory, and resonance subsystems are working in an efficient and, functional way for the person that is the voice performer or the voice
Mhm.
user. Rehabilitation is the understanding that something has happened to impact that baseline function. So whether that's long COVID, whether that is, your traditional vocal nodules, polyp, presbyphonia, and vocal or presbylaryngos, vocal fold bowing, something has somehow impacted, or maybe there was an injury after intubation, extubation, or something that's been impacting, which is pretty common for vocalists if they haven't had that opportunity to talk to a surgeon, or there was an emergent intubation that occurs. These are things that we think about as like, oh, okay, something changed, either respiratory function changed, vocal fold closure, vibration. So there's either like anatomical or physiological changes that have occurred, or something has shifted that requires us to actually have a therapeutic approach versus we're just trying to optimize and do something that could be under the umbrella of coaching or could be under the umbrella of habilitation. So that's in terms of what made me want to work in this area was that I'm a classically trained singer from before. I train in what we call contemporary commercial music as well now, where it's more like pop oriented or musical theater oriented or jazz or, so on and so forth, things that we listen to on the radio or things that we hear streaming on Spotify. But growing up, I was classically trained. I had a lot of anxiety when it came to singing voice. I felt like whenever I was in performance spaces, especially, my voice wouldn't deliver or I would get these inconsistencies. And my response whenever I was working with the different voice teachers and voice coaches was really dependent on the relationship, but also like I felt like I didn't really have a full understanding of the systems in place. I didn't understand how singing worked mechanically. And I think I share pretty openly that I'm a neurodivergent person. So for me, I'm like, I want to know how those pieces occur so I can know what I'm working with. And it wasn't until I trained to become a speech language pathologist that I felt like I understood my instrument better. But I also would say that without being somebody who trained in voice as a singer, I don't know if I would have known how to work with voice without that part. Not that SLPs who haven't had a voice or singing background can't work with voice. This is just like my particular history was such that, I feel like I learned so much about who I am as a clinician working in voice from my singing background, but then I also learned a lot about who I am as a vocalist and how to work with vocalists from understanding these pieces in speech language pathology, whether it was, and it wasn't really necessarily that my graduate program had a robust voice component. It did not. I went to the Summer Vocology Institute by the National Center for Voice and Speech. So that's Ingo Tietze, and now it's Lynn Maxfield and company who organize this on an annual basis. That was something I
Mhm.
did after graduating. And I think the reason I wanted to work with it was because I knew what it was to feel stuck. And I understood that there was an importance of empathy and lived experience when it comes to navigating the singing voice that I felt like, oh, I know what that feels like. And I know how difficult it is to feel like you can't sound the same way every single time, or you don't know how to meet yourself in terms of the challenges of the instrument. Even if I wasn't somebody who was, a gig musician or having to do that for professional needs, I felt like it was something that I could really empathize with. So in terms of like how I got started and some of the education that I explored, that was it. That was where I started anyway.
Yeah, and I think it's really cool because I think one of the things that I really when I first reached out to you was that I had quite a few students that were undergraduates who came into our program because they either had a singing background or they wanted to specifically treat singing because it's sort of like concurrent. They were singing in like a collegiate arena, but also wanted to figure out exactly what you said. But then I've had more than a couple. I've had quite a few students who were previously trained either opera singers. I had one from the Berkeley School of Music who then realized that it was very difficult for them to break in and make a living doing
Right.
the vocalist part of things, and they felt like it would further advance them if they had this sort of, I think they approached as like a side gig almost of being able to coach maybe peers or move into more of this, this, like you said, vocologist role for singing habilitation and rehabilitation. But the interesting thing is that one of them is now singing professionally in as an opera soprano and making money and traveling and doing all the things, but also went on to get a master's degree, not in speech language pathology, but in, I don't, you might be able to help me. I don't even know it was music, but with a specialty in, I guess,
There can
voice.
be there's master's programs in like vocal pedagogy or that are related to performing voice or,
Hmm.
it can be a number of things. Yeah. So yeah, I mean, I was not given like my experiences when I was in music school. I dropped out of music school, by the way, when I was in when I was doing my bachelor's because it wasn't, for one thing, I didn't have like I don't think I had the right fit in terms of a voice teacher. And, my family was kind of pressuring me to be pre-med at the same time because they wanted me to be able to have, you know, security in a career. And I couldn't put those things together. And I think I'm a reasonably intelligent person, but to have to do like basically rehearsal and all of this music work from like 8 a.m. to 5 p.m. and then also be able to do all of your bio and chemistry and physics requirements for STEM related fields was just not, it didn't click for me. It was not possible. And so I had to kind of find a way to put all of it together. And this was speech language pathology was like the closest I could come, with additional time as a non-traditional student to bring it all together. So yeah, I mean, I think a lot of people find their way to this path by many different ways, I suppose. And I think a lot of people can bring important perspectives, I should say, to singing voice habilitation and rehabilitation as well.
So if you knew someone who was an SLP, say they're, it could be seasoned or a newer person to the field, how would you say it would be important for them if they chose to work or wanted to work in singing voice habilitation and rehabilitation? How do you prepare for this? And what kind of recommendations would you have for SLPs that chose to go that route?
Um,
And that's a really long question for a really long answer.
A really long question for a really long answer. I mean, I think what's important to remember is that if you are interested and passionate about voice and you can demo things, it doesn't necessarily have to be singing voice related, but you can demo vocal behaviors and you have really good counseling skills. Those are like kind of the foundation for working with singers. Singers are oftentimes their own technician in many
Mhm.
ways. They have advanced knowledge. They may have quite a bit of great vocal pedagogy knowledge from their training or from voice teachers. And it just depends on the person in terms of their experiences. But they're not necessarily looking for you to have expertise in how do you sing beautifully. They're looking to you for expertise on how do I do this easier, you know? And so I think I would recommend for any SLP to potentially take voice lessons just to get used to using your own instrument, get used to demonstrating things, build empathy with what it's like to be a student or what it's like to be in this other role with the power differential being what it is. As much as we try to level things out, it can be really difficult and intimidating for somebody to come in and talk about something that's as integral and emotional and vulnerable as their voice, and especially if it's something that their voice is an important part of their identity or an important part of their income. Those are things that like are really important to take into consideration. And so being able to build empathy and the understanding of what it's like to come in and to try something. One example I'll give is I went to a couple of like group voice acting classes and I was completely out of my element. But I needed to remind myself of what it's like to not know what somebody else is looking for and to say,
Okay.
oh, okay, I have some idea of like what I'm supposed to do here, but like I might not know exactly what I'm supposed to do, how I'm supposed to interact, or how I'm supposed to approximate whatever target it is. And that sense of newness really gave me an understanding for what it feels like when a client or a patient walks in the room and wants to work with me. If they feel like, oh, the clinician might be holding all this judgment. So we have an opportunity to say, like, we're not really the harbingers of like vocal excellence. I'm here to make your job easier. And there can be many tools that a clinician can use. I think just being able to build a strong voice therapy background, whether we're talking about resonant voice, whether we're talking about things like stretch and flow or flow phonation, and being able to support people when we're trying to talk about like things like high impact voice use and projection. I think building connections with people who do like extended voice use. So when I'm talking about extended, I'm talking about like things like metal singing, punk singing, rock singing, things that more distortion that might involve more of the pharyngeal muscles. And it's not my subspecialty by any means, but I think being connected to a lot of different types of voice providers who are science-based, who are focusing on vocology, voice science, and are, kind of have this like robust continuing education. I think the networking thing is really, really important. In other ways that I would say to prepare for working with singing voice professionals is it's very interesting when my brain has like word finding issues all of a sudden and we're on air, but we're going to get through it. Other things that I would do is also, well, there's a wonderful continuing education platform called Voice Pro Ed that's run by Maurice
Yes.
Goodwin and Anna Deemer. So I think they do an excellent job of creating coursework about making singing voice accessible, understanding what the role is of the singing voice professional versus the voice coach. I think be networking with other voice professionals as well, in particular voice coaches, is really important to have a respect and an understanding for what is in their scope, what your scope is. I can't underline the importance of counseling in this area and things being really client centered and focusing on the sensory and kinesthetic experiences that the client or the patient has, because that's everything. Part of the reason we know anything is wrong or is off base for someone is because of that client report. It's you may get that in acoustic and aerodynamic assessment, and you may get it in the numbers, but it's really about the client and the patient reported outcomes in a lot of this work in terms of like functionality, unless we're talking about, pitch perturbations or issues like that, or not getting adequate vocal volume. I think doing early continuing education, often one of the things I tell students that I mentor is that if you have access to free or low cost CEUs, take it while you can, even though it's not going to count towards anything. I did so many different fees and rigid video stroboscopy courses just so I could get that access to understanding laryngeal imaging, even if I knew I wasn't necessarily going to work in a traditional voice and swallowing center, and I certainly don't now. But it gave me a lot to work with, and getting that repeated exposure is really important to voice knowledge. So I mean, I would say go to voice conferences when you can. There are tons of high quality voice CEUs online as well. Brushing up on your skills on with like a program like MedBridge has a lot of, I would say, world class like voice specialists on there talking about different aspects of voice therapy, and understanding that you're always going to be expanding your tool belt. There are also things like, there are other programs, like some people will go to Estill Voice, or some people will do somatic voice work, which is Jeannie Levetre's, program. You can totally learn a lot from voice voice coach and voice teacher driven modalities as well. And I think one of the myths about working as an SLP is that we don't borrow from other fields. And I'm like, Yeah, we do all the time. We learn about techniques, we learn about making exercises and shifting exercises or shifting vowels or shifting different ways that people can warm up or cool down their voice based on client response all the time. And so the more tools that you have at your disposal and the more that you've gotten to see people work with singers, whether it's in masterclass settings or in some of these courses where will they have students demo, this is what will kind of help you start to build your vocabulary around things and building your ear as well in terms of describing things that you're hearing and understanding mechanics. I do highly recommend like doing a vocology related program, whether it's, Howell has hosted conferences like this that are more accelerated. I felt like the Summer Vocology Institute, as well as this, like all of the learning was really valuable, particularly the acoustics and physics sections. But that's just me because, I'm a nerd. I think I think it's important to understand like theoretical underpinnings and how things work. And I think when we're talking about the nuts and bolts of working with a singer, it's understanding that these can be like highly sensitive people, highly passionate people, people who've really invested in understanding their own body. And it's a real challenge to remind yourself that, like, in this case, the expert is the vocalist that you're working with.
Mhm.
And you're like the guide and the sounding board and the like, this is stuff I understand about voice science. This is stuff I understand about the human body. This is stuff I understand about um laryngeal function, but like seeing how things land and building that relationship is so, so important.
Yeah, no, and you brought up like 27 good points.
I'm sorry.
No, 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 no. This
That's
is
low
great
for me,
because
maybe. No.
well, it just it takes me back and makes me think about like patients that I've had or experiences that I've had that are not necessarily a singing voice thing, but it speaks to the role of counseling for SLPs, which a lot of people I feel like have either shied away from or been intimidated by, or maybe even thought it wasn't within our scope. But things like functional neurological disorders, functional dysphagia, things like that, that really have more of a counseling based role for us. Listen, active listening, which is hard because we're SLPs. A lot of us like to talk and or sing. And it's hard for us to sometimes just sit and listen and then take it all in and analyze that information. But it is such an important piece for a lot of our patients. But like you mentioned, particularly for patients who are trained in this role who've performed, there's a lot of self-esteem issues that can be impacted by this thing that happens if they're no longer able to perform in the way that even if other people don't notice it, but they see it themselves or they feel it themselves that something is off, which is something that you said can be really impactful for them performance wise, but also it gets into that psyche and you start to see these for someone who has, anxiety for an example, or maybe is prone to having some depression and things like that. It can play into those pieces. I think people are often overly critical when they go to a show or, we hear it a lot in the media. Well, so and so is such a great singer when they record, but they sounded terrible live. And it's like, who are you? Could you do that?
It is strange to like interact in an environment where people feel that, that like everything is kind of up for commentary when it comes to vocal performance. And there is a lot of, I think, stigma around public figures, whether we're talking about somebody like Adele having like a vocal fold lesion and saying, oh, especially in the voice community, there's ha- there's had to there has had to been a lot. I can't even say it out loud right now. It's great, but there had to be a lot of destigmatizing conversations and language around the fact that these are high level performers, these are vocal athletes who are the extent of voice use often puts people at great risk. And that is not something to pathologize. People are making decisions about, like, this is their livelihood, this is their work, their passion, their artistry. And the reality is that everybody's individual laryngeal tissues are going to be either more or less susceptible to phonotrauma and resulting, damage. And that isn't necessarily because of faulty technique. That's not because
Hmm.
somebody didn't, do everything that their voice coach asked them to, or they didn't drink enough water. Like there's so many factors at play that it's really important to remember that we don't blame the voice user in this case for, like, what happens,
Hmm.
or make assumptions about what we're hearing without imaging and being a part of the team. And I think the other piece that you're talking to is that, yes, I think a lot happens in the studio, and that's not just a single person with a microphone. There's audio engineering, producers, everybody's involved in, like, trying to capture this best case scenario of you know, a vocal instance, a phenomenon, as it were. And then when you're going to see a live show, yeah, there's some people who are fantastic live, and then there's some people who, like, I don't know how much dancing, movement, what other stressors are involved, and those are all things that play into the voice. And, like, even when I'm thinking about Leah Halu's, like, work talking about people who are laryngo responders, there are also people who may have additional stress, compression, and non-ideal vocal outcomes whenever there's a performance piece involved. And so I try, with my slightly older age, to reserve judgment as much as I can around what somebody is doing with their voice, if something is at fault, what needs to be done, and focusing on the fact that my role as a clinical provider is to be a sounding board for me to say, okay, these are the things that we do to manage reflux. Reflux is associated with potentially, with a lot of impact for inflammation, and then down the road, possible laryngeal cancer if untreated, and so on and so forth. So what do we do to deal with reflux? What do we do to deal with vocal fatigue? What do we
Hmm.
do to deal with the actual symptoms that somebody's coming in with? And really tailoring our our support and our perspectives to whether we're asking for behavioral changes, whether we're asking for environmental changes, whether we want just informed consent of, like, hey, if you tour this often, or if you sing this often and it's like this, and that we call it the vocal bank. We know that your vocal bank can only manage so much, that you understand what the risks are with this type of performance schedule. And that at the end of the day, the client and the patient has to make an informed decision for themselves in terms of their livelihood, what helps them feel supported. And I think, you know, every vocal performer who, especially if we're talking about working, and, like, this is a major part of their income, a major part of their life, most of these people are going to be connected with an interdisciplinary voice team anyway, where there's a laryngologist and an SLP that you're going to check in with before you go on the road. A lot of the folks that I work with are avocational, or this is like a side thing, or this is like their passion project, but they do other things and they have other voice needs. And I also work with a lot of people who've, you know, taken testosterone and want to work on their singing voice as part of their kind of their gender journey. And so, and navigating, how do I figure out how to use my voice now that the vocal folds are much thicker, but and everything feels different, and navigating my instrument is a completely different thing. And so, yeah, I mean, it's very important to hold space about what you can determine, and where there are too many variables for us to, like, really attribute anything in terms of, like, this caused that, when there's so many variables and so many pieces involved in the picture, if that makes sense.
Oh, no, it makes perfect sense. And I was actually sitting here thinking about when you mentioned people who tour, whether we're thinking about, Adele level stars, Beyonce level stars, or you're thinking about just people who are maybe not so well known globally, but people who travel with Broadway shows, people who are opera performers who go to different countries, go to different environments, and how much that different weather, that different humidity level, that different altitude, how much do those things play into, their prep? Do they prep for that? Because I really just don't know.
Yeah.
Is it something that they're able to prep for, or isn't it one of those unknown
I
variables?
I think people talk about use of like portable nebulizers with that 0.9% saline solution that's ideal for, um, hydration of the mucosa, as well as just like your traditional hydration of drinking water and having a humidifier and doing all of those pieces in terms of like maintaining as well as getting good rest, maintaining like overall good nutrition. But humans are humans, flying, traveling, like interpersonal stuff, family life, all of those things can be impactful with the voice. And we have to have a holistic mindset to meet folks who are singers who need us, and understanding, okay, there are lots of pieces that could be going on. There can be, a psychological or psychogenic components that are happening in that are concomitant with an actual voice disorder with some sort of like, you know, etiology that we can actually see on the scope as well. So it's a balancing act of getting a sense of like how do we support this person best in terms of moving forward and figuring out what is it that they actually need from us. And sometimes it's also connecting with referrals. I mean, sometimes we have to be really aware of mental health needs and peer support. And I had a client I worked with who, like, we had discussions around, hey, I don't know if this choir that I sing with and I do solos with them, I don't know if like that really serves like my instrument as much, because they asked me to do some things that in certain keys that don't actually like sit that well anymore since my voice changed and everything. And so I have to make people helping people soundboard and make those kinds of decisions as well, and understanding what the impact is it can be a big part of it.
Yeah, no, I think that's great. I mean, that for me, I'm learning so much just in this short amount of time because again, this isn't my niche. It's not what I do, and I think that's one of the things that I was really interested in connecting with you was looking at the unique challenges when you're working with someone who is a performing voice person, because I think well, at least in my voice class and in graduate school, when we talked about voice overuse, abuse, misuse, that was really what the focus was disease, disordered, overuse, misuse, and abuse type voice situations. So, we talked a lot about teachers and pastors and people who constantly speak and talk and maybe didn't have great vocal habits, but what you're talking about, or people who have had this training. So, as speech language pathologists, what kind of challenges do we have to work with those people with the performing voice needs other than, you've mentioned the counseling, you actually mentioned quite a few things. One of the coolest things I think you mentioned though was, and I'm backtracking a little, was even though you may not be actively performing fees, so fiber optic endoscopy for swallowing. When I went to my fees course years and years ago, one of the students in the class with me was someone who was a performing vocalist and had some hoarseness. And when they scoped her, she had a vocal fold hemorrhage, and she had no idea because she had not been to her ENT. And of course, as students, we were students of fees because I was already at SLP. But I was like, oh my God, that's so cool. But at the same time, I was like, oh no, what's this going to work? How's this going to work for her? How do you fix that? Like, again, that's something that we don't see.
A hemorrhage, I'm not a laryngologist, but I would say that it really depends on the person. Relatively young, if they're able to go on vocal rest and then transition to doing like some resonant voicing and not perform or hold back from performing, and they're able to get this like interdisciplinary support, you know, it happens, I'm not saying it's not important to pay attention to, but like I think personally when I hear that story, I'm like, I think it's great that, that was something that was caught, and that if she didn't have a provider yet, that this is somebody that there's an understanding of, oh yeah, like this is something that happens to folks, and that you need to be able to consult a team if you have access. You need to be able to get checked out or call in and pay attention to these pieces, and understanding that, when care or when intervention is appropriate. And so, I mean, that's like a very real situation. And I think it's a great story. Hemorrhage in and of itself, I don't think is necessarily like, it's definitely a, hey, like a stop sign, but I don't think it, like in terms of like somebody's future, as long as like the behavior is addressed and that resolves, and they don't need any follow-up procedure or surgery from the laryngologist. I think I think I think that's a great example that you shared.
Yeah, it was certain, and again, I was much less seasoned back then, and that's my thought. My initial thought was, "Oh my god, that's so
I
cool."
mean, it
But
looks
then
so
now,
scary because it's like it's
it
what was it,
was,
bright red on there? Yeah.
yeah, it was like a big bright red line, and it was pretty significant. And of course, we as student SLPs, which again, I mean, I had my C's and everything, but I was going to fee school, which is a whole different thing because you're looking at something that's you know the anatomy. Well, you should know the anatomy at that point, but you don't know it in the way that you know it when you do like stroboscopy or
Yeah.
scoping on a regular basis. It's a whole different skill set because it's sort of like doing instrumentals for dysphagia. You think that the anatomy, or at least you should, but the physiology part sometimes comes with experience because again, you think you know it, but once you see it and you're clinically looking at it all the time, it becomes a whole different thing. And so that kind of brings me back to just, what are some other unique things that you feel like performing voice patient may need that the average everyday SLP might not be aware of?
Oh, that's hard. I do want to make a quick disclaimer that I'm not saying like a hemorrhage, varix, or ectasia is like not important. Please get checked out. Please
Oh yeah, no, for real,
definitely
no.
definitely go to the ENT. Definitely get imaging. Let like go to your team. But yeah, I mean, if I'm thinking about what the average, I mean, I think more SLPs could afford to be curious about voice
Mhm.
and not feel like it's a scary thing. Because I feel like a lot of the way that it's taught and a lot of the way that it's approached, like you always have like one or two weirdos in a class who are like really into the voice class, and the rest of them are either like, I'm gonna go fully medical and I'm gonna do like neuro and like, dysphagia. And then you have other people who are like, I'm just gonna be working in schools, like I'll never have to deal with this. But voice comes up, whether it's, gender
Yes.
affirming voice needs, irrespective of where anybody is in the country and whether things are, what systems are in place. You're going to get asked about that at some point if you're in an
Mhm.
outpatient setting, probably. And you might even get asked about it if you're in a school-based setting, probably. If you're going to see people who are teachers and people who work at the DMV and people who are very forward facing, you might even see physicians. You'll see there are lots of people have voice stuff happening, and I think because it's not something that, because we don't have direct imaging in all settings, or especially if we're talking about like not every graduate program is not necessarily going to have access to this. There's this sense of like, I can't see it, and I can't measure it the same way I can with like, if we're talking about like something related to Arctic phono, or if we're talking about something, well, I can't use dysphagia as an example because like obviously we use a lot more instrumentation to guide assessment and therapeutic outcomes and goals as well now. But I would say I think a lot of it is like not being able to see and not knowing, not people, a lot of people don't even like their own voices. They're like, okay, this is the voice I have, and this is like what works, and I'm just going to talk, and I'm going to go, and I'm going to be on my merry way. And it's not until people run into a problem, SLPs included, with their voice that they think about voice at all. If they're not voice specialized, or they haven't chosen it as an interest. And so I think I think the thing that would be most helpful is be curious. No, if you want to work with voice people, definitely like go down the rabbit hole of continuing education. There are a lot of like free resources. Like there are also people demonstrating straw phonation all the time, but don't just stop with straws when it comes to exercises. Learn about all these different ways, other semi-occluded vocal tract exercises, as well as exuberant voice, whether we're talking about forte or speak out or LSVT loud.
Love speak out.
Right. I love speak out, but like learn about different ways that you can use your voice, embrace that idea of vocal play. I mean, and I would also say, like, know who in your area does this well. Be like networking with, voice teachers or singing voice specialists, as well as SLPs who are in this area, getting mentorship if you were wanting to work in this area as well. But yeah, I mean, I think that curiosity piece and focusing on building the knowledge in that area is important. I'm somebody who, like, I go to a lot of voice continuing education, but it's gotten to a point where I'm curious about different areas like AAC. There are things about like neuro rehab that I need to like brush up on and I'm curious about. So I think being more open to, even if it's not something that you may not normally see in your current setting, it's great to embrace that curiosity and seeing what's out there and having, getting some familiarity and dipping your toes in is something that I really like to encourage people to do. Because even if your voice class, excuse my language, if your voice class sucked in grad school, that doesn't mean that your relationship with voice or that your understanding of voice is always going to be that way.
Yeah, mine was going to be that even if your voice class was scary,
Yeah, and scary.
because I felt like mine was a bit scary. It focused like again on disordered, and a lot of the voice class for me focused on head and neck cancer, which was
Mm,
as a student was terrifying because I didn't know we don't being a student was hard enough, but not knowing what we were going to walk into sometimes was also like, oh my God, how in the heck am I going to remember all this stuff across this continuum? And so I think your point being curious is so great because when I go to a state conference or even when I go to ASHA or other national conferences, sometimes I go to like the most, I don't want to say random, but it's random for me because it's not something I'll sometimes pick something that I think is going to be super interesting
mhm.
that counts as CEUs, but also just because I am curious and I want to know about it. So I've gotten to see like Dr. Joe Stemple. I got to see Dr. James Coyle. He came to our state conference many years ago. And it's funny because some of the time, things that I went to that were not something that was neuro rehab, which is my specialty, I met people who wound up being like integral in my professional and my personal life because it was a connection that I made that led to other connections that were real and relevant for both of us. So it's been kind of cool to go to this what we would have thought would have been like a random, I guess it's a random course, but yet it wound up being it turned into something else that was I was meant to be where I was meant to be and I
Yes.
don't know that was actually it was my choosing, but was it?
No, I think this the serendipity happens a lot in my work too. I mean, even for upcoming ASHO, Karina Seychow is a PhD candidate, and her focus is largely AAC, and that's what she does in her private practice. We're great friends, and we're doing something on voice and AAC, and basically talking about choosing voices, what makes a voice, and like I'm not an AAC specialist, she is. She's not a voice specialist, I am. And so for us to get and bring something like this together and build awareness across like two different areas is like really awesome. And so I think that's the other piece is, a lot of people are like, well, voice is all the way over there. And I was like, does it have to be? Or do
Yeah.
any of our areas have to be so like not communicating with each other or not aware of the ways that we can integrate and actually collaborate? And I'm really interested in building those opportunities. And I think that's the thing I would encourage most is like, yeah, just the curiosity and seeing what the possibilities are. Like I think it's really important for voice SLPs to understand AAC options and know AAC providers, because you never know when you might have somebody who is a part-time AAC user or who has situational mutism, or you run into, or it's a head and neck cancer situation, and
Hmm.
and it's somebody who could really benefit from having an AAC, some form of AAC, whether it's an SGD or so on and so forth. So I mean, I think, yeah, we just become a better SLPs the more informed that we are. I feel like I'm much better as an SLP, but also just at like parties, because I know some things about school-based issues. I know some things about, outpatient in areas that I don't necessarily work in. I did a lot of continuing education that was related to head and neck cancer when I was finishing grad school. I don't necessarily get to use it directly, but it still fascinates me, and I think it makes me a better practitioner overall, just because I've networked really well. The real thing is that folks that we know get diagnosed with things all the time, and because of those connections too, we are able to help people get optimized help when they need it, especially if it's one of our own who's an SLP. So
Yeah, no, I 100% agree with that. And I think this whole like, you have to be a specialist. And if you're a generalist, then are you really doing your due diligence? I'm really kind of overhearing that because I feel like for me, I was sort of a generalist. I guess that's how people viewed it because I came up and worked in inpatient rehab and LTAC and then went to acute care before I went to outpatient. But at the same time, I learned things in all of those arenas that made me a better clinician and a better diagnostician. But I always had a start, like I got my certified brain injury specialty back in 2012, which meant I studied really hard. My employer paid a fee and I took a really hard test, but I've maintained that throughout the years in addition to maintaining my skill set for dysphagia, but I don't want to be board certified. Could I be? Maybe. I think I know enough, but it's not really what I want to do and how I want to spend my time. And again, I think that that tie-in that you made about being looking at across the continuum, especially of the lifespan, our patients who wind up having voice disorders often have other things that we may have seen them for before. Just like the potential for voice with AAC, there's a lot of potential for voice development as far as the nature and the quality of the voices that AAC SGDs are using,
mhm.
which is a huge connection because, 10, 15 years ago, there was like 2 voices, maybe
Yeah.
3. Now there's like hundreds of voices. And so that's, I think, just a really cool thought. But, as we're kind of getting towards the end, what would you like to see more of in the performing voice or singing voice care world?
Accessibility. I
Mhm.
feel like there should be encouragement for SLPs who want to go in this area to learn more and to have access versus having to be in, you know, one of the major like university centers that has a voice and swallowing center or has a robust voice program, and being like, how do I break in? Because in a way it was me, even though I feel like I did a lot of the continuing education, but I want people to have access to that information. I think the performing voice and singing voice care world should continue to grow in compassion, continue to grow in getting away from like ableist expectations or ableist perspectives. One of the things that I'm very passionate about is like neuroaffirming care and understanding that the way that we navigate our voices and how we use our voices and our sensory experiences of our voices are going to be different, and how people learn different voice techniques that changes as well. And so I think continuing to go in that area, and of course continuing to encourage people to understand both the needs of like cis and trans voice performers, especially when we're involving hormones, or if things change with regard to laryngeal surgeries. Like I want to see how all of that plays out, and just I think greater transparency for everybody, because I think I really empathize with maybe a lot of people who are here tonight who are like, always wanted to work in voice, and I didn't really get a chance to, or I'm starting to get voice referrals, but this was not something that was really built into my curriculum when I was training before. I never had the opportunity to, and so yeah, this is I think that's how I feel about it.
Yeah. Follow your dreams, man. That's
Look at us.
good.
We're doing
Well, and
parents to
I
everybody in
do.
the chat.
Yeah. Well, and we did have a question, and so because we're kind of wrapping up our question, like my questions for you. So Marlene C, classical singing voice is clear as the person is using singing technique. When speaking, there is a hoarse vibration type of quality, possibly mainly on vowels. No physical problem with the vocal cords. What error is the singer making while speaking? And what would you recommend therapeutically in that situation?
Okay, I have a
Hmm.
few follow-ups on this. So my thing is, does the person feel like there's a problem when they speak? Or does this impact them in their singing at all? The way that they speak, are they saying that there's fatigue, or do they not like their speaking voice? That's the first part. And so, you can give them a VHI, VHI-10, and like do some of the counseling to see like, is this something that bothers them? If it's something that bothers them, because like honestly, I went in to see the laryngologist just to get things checked out this year. When I went in, it was like first thing in the morning. So I ended up talking like this, and I was just like, and then, Dr. Wong was just like, "Is this how you always sound?" I'm like, "When it's in the morning and I'm not really feeling like it, yeah, this is exactly what I sound like." Which is the truth. And I
Yeah.
do fall into fry pretty frequently. And some people will get concerned and say it sounds really compressed, this, that, or the other. But I'm like, I know what to do to get myself into my modal voicing. And so I think it's always good to assess for stimulability around like if you do things like hoarseness is concerning to her as it could affect her vocal cords. Yeah. I think when we're talking about hoarseness or roughness in the vocal quality, the why is really important. So what's really important for somebody like this is I would want to know if you did a flexible endoscopic evaluation, you did strobe, what's happening when she's singing, what's happening when she's speaking. And I think that would
Hmm.
be the easiest way to kind of at least see if there's anything going on or what are some of the behaviors. I think I I and you've said that there's no physical problem with the vocal folds. It may be that like it's resonant voice related and that basically there may be a lot of base of tongue tension, there may be jaw tension, there may be just like less airflow. One of the jokes that Edie Hapner often says, I think it's probably more common than that, but she'll say like, does this person have low phlonia? Which means that basically they use optimal airflow for
Yeah.
singing, but they're not using this optimal airflow for speaking and getting to use you can use biofeedback measures. You can go simply in terms of using like flow phonation tasks with like fricatives, with using like the like napkin or the tissue paper or something to show them like this is what it looks like when you're just exhaling. This is what it looks like when you're actually using the airflow or using things like cup bubbles, straw phonation to kind of build that awareness of how much air needs to be used, as well as decreasing that amount of compression with some, back pressure towards the vocal folds. There are a lot of things that I would do with this person to build awareness. And then somebody said spasmodic dysphonia be a possibility. Again, I feel weird because I'm not in front of the person. And I think this is
Yeah.
one of I don't know if it's my weakness, but it's one of those things where I'm
Mm-mm.
like, I need a chart and I need to talk to someone and I need to like feel things. I mean, if somebody's vocal folds look fine and you were able to get that from a laryngologist and they did strobe, not just based on like a regular ENT
Straight
with just
scope.
looking at the
Yeah.
image and the singing is clear. Well, I mean, I would also look at, like, what pitch range are they voicing in? Are they trying to
Hmm.
pitch too low because of, like, sometimes because of personality? For me, I didn't wanna feel like I hated getting the feedback that my voice was too high when I was a kid, so I started to, like, voice as low as possible, and I would get into fry, and, yeah, I mean, I think, like, this is a great question, but I think part of it is what tasks have you thrown at it and what makes it better and what makes it worse? is that piece, the it's kind of that differential diagnosis piece of seeing what darts land. Is it the resonant voice thing? Is it me, may, mamo, moo, 1, 2, 3, 4, 5? Is it doing things on a beat? 1, 2, 3, 4, 5. We're thinking about an owl. 1, 2, 3, 4, 5, and being able to build off of that from automatics to whatever, or getting into conversation. Are you able? One thing I would do is maybe use like a spectrogram software, and they do have free ones on online as well. And then using that biofeedback to see what's happening during the singing, and can you make the speech more like the singing, and how do you feel about that? Whether it's to get that sense of continuity, or pitch range, or whatever, what have you. Getting that feedback can be huge as well. So, I mean, I think there are a lot of tools in place here, but I also highly recommend, if you ever have questions, one of the Facebook groups I'm in is the clinical voice practice one, and like people are really very kind there. You can always join in and ask questions, as well as on, I think, SIG3 for ASHA, and the Fall Voice also has some sort of forum. So feel free, and you can always email me too and reach out if you have further questions, and I can try to connect you with somebody so you can get your questions answered too.
Yeah, one of the apps I recommend to my students if they're interested in dabbling because they are curious is Voice Tools, which is the free app, and it has a wide variety of measures on there that are pretty accessible, especially for people who maybe don't have a lot of experience or aren't considered like voice specialists. But it's interesting to see like where your voice lands, what your resonance and your pitch look like. But Ruchi, goodness gracious, I learned a lot. Thank you so
Sorry
much.
about yeah, I can be a lot in a short amount of time.
I don't agree with I think you were great. I want to be a lot with you.
Yeah.
I think that one of the best points you made at the end was saying you needed to be able to see the chart and the person. And I wholeheartedly agree with that. So I don't think that's a weakness. I think it's a responsibility because it is hard for us to sort of do this diagnosis without the totality, of all the pieces of the puzzle that we need in order to make that diagnosis. So I think that's a really important piece. So again, I just appreciate you and thank you for being on with us.
Of
Um,
course. Thank you. All your folks are being so nice and being so appreciative. And it's one of those things where it's a Monday and you're like, I don't know what's going to come out today. I hope it's good.
yeah, it's all good. It's all good. Ruchi, again, thank you. And we look forward to seeing you again.
Thank you. I'll pop on. Thank you. Thank you so much for having me. I had a great time.
Great.
If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. Each episode comes with an accompanying course on speechtherapypd.com, available for a 0.1 ASHA CEU. And just for our listeners, get $20 off any subscription with promo code BRAINSTORMS20. SpeechTherapyPD.com is run by SLPs for SLPs. We've got the largest library of ASHA CEU eligible courses out there, adding fresh content every week. Remember, use BRAINSTORMS20 to get $20 off access to over 1,000 courses for an entire year. Head over to SpeechTherapyPD.com for more information and start earning CEs today. Thanks for tuning in to Brainstorms, Functional Neuro Rehab for SLPs. And don't forget, SpeechTherapyPD.com is your go-to for all things ASHA CEUs. Your positive reviews and support mean the world to us. We'd love for you to drop us a quick review and hit that follow button.